And there we go. Okay, we can just line as well. Yeah. But it is 8 o'clock, so why don't we call the meeting to order? First, do we have anybody from the town who wanted to be recognized? Or
No one's communicated with us that they'd like to make a public comment.
okay, anybody here want to make a public comment? So right. Seeing none, we will proceed to review of minutes included in your packets. Motion to approve.
Motion to approve this.
Okay, I'll take 2 motions to approve this. Okay, all without objection, we'll pass the minutes. Staff reports. Sorry, this time we're starting with substitutes. So.
Carolyn and I have been working on strategies identified, chosen in our strategic plan. One particular that we've been working on is the risk factor identified through the process of inconsistency of consequences across our towns related to youth substance use. So we selected as a group with our community members the I Decide program coming to That's Primary Hospital, which is an alternative to suspension education program. And we recently had a meeting with the I Decide team to learn more about if and how it's being implemented in our 4 towns, barriers to implementation, and next steps. Looking at now meeting with each of our towns and working towards implementation of it.
Any questions?
Is this suspension from school?
It's alternative to suspension.
Alternative to suspension from school. Okay.
Or substance related chemical health violation.
Good morning. I'll end my comment brief, so you'll be hearing more from me later, but last month we had our stand fall meeting, which included the presentation of the 2023 Metro West Analyst Health Survey substance use and mental health data, which you'll hear from me in just a few minutes. We also partnered with the police for our October drug take back day. And at the event, 88 pounds of prescription and non-prescription drugs were collected that day. And combined with the collection over the previous 6 months at the police station of just under 600 pounds, we've had an average over the last 6 months of 99.5 pounds per month, which is a considerable increase. Compliance check, we partnered with the police on that. And there were 2 sales to minor violations during this check, 1 to an on-premise and 1 to an off-premise business. And we'll have a chart that I put for summary of compliance checks and stuff at the end of my report. And then lastly, too, at the special town meeting, the peer recovery coach position was approved by the town meeting vote. For the next 6 months, if you will, as a full-time position with further approval pending in the May town meeting, but we're quite happy about that.
Any questions for Claire? Okay. Move on. Next we have Share Public Services. Snap on.
Skip to the next one, I guess.
Yeah. Okay, public health fairness lead.
I don't think he's on.
Who's not on? Okay. Is Tiffany on? Epidemiology.
Tiffany's not on.
Okay. Yeah, and I don't see they're not going to do nursing.
Wait, Hannah's on.
Oh, Hannah's on. Okay, good.
Yeah,
So you can do nursing.
I'm also on too.
Oh, you are. Okay.
Sorry, I couldn't be there in person today. I just wanted to highlight that we did do several flu and COVID vaccine clinics, which I'm really proud of, with our per diem staff and our full-time staff. They were well attended. Hannah and Jonathan Steves from Fire, they ran a PSA on CPR that has been running through social media, and it was done in partnership with the Needham Channel. So that got pushed out and really pushed people to sign up for CPR classes. Those are really the two things I wanted to highlight, but I don't know if anybody has any questions for me.
Any questions on this report?
No.
All right, good. Sal, environmental.
Yeah. Okay, so in October, we're quite busy with preparing for food safety training that we performed in Power Hall upstairs in early November. We had 3 trainings and they were well attended. We had over 130 attendees from probably like 85 restaurants in town. We had our own staff members perform the training, so it was myself, Tara, Pamela Roskong, and we also had assistants from Amy from Shared Services. I think the training overall was a success. And we also had Burger Food Safety host a Spanish version of the training for Spanish speaking employees in town as well, and that was all well attended. So overall, pretty good success, and we're right now analyzing the data from the surveys from that training.
I can continue with, we did attend some conferences recently, so I attended the 62nd annual Yankee conference from October 16th to 18th, and also the NHOA conference last week. Monica Pinkert and I did attend the FDA retail seminar conference in Burlington, Vermont last week, so that was pretty interesting. Got some good information on there from the standards as far as, you know, next steps and what we should focus on. And we had just applied to the FDA grant on Monday, so we're hoping to get more money to continue our progress with those standards. Also, I wanted to mention a little bit about the enforcement actions going on right now. So as you can see, Mandarin and New Garden were being overseen, are still being overseen by food safety consultants. I believe Mandarin, we just released them from their food consultant after 6 months. And now we're going to be watching them to make sure that they maintain their food safety protocols. They've been trained, retrained, and spot checked. So we're going to keep them on our radar. New Garden, we extended their contract for another 3 months. They have some staffing concerns as far as the staff had left. That was really good. She was really trained and she had left. So now we're kind of like backtracked a little bit with them, but we're hoping they can still maintain their food safety protocols going forward. So we kept them on for another 3 months. We'll assess them again at the end of the 3 months to see if they're ready. And then Farmhouse, we just required them to work with a food safety consultant in mid-October. Again, this is due to our food safety policy. We're able to bring them in for administrative meeting and state, this is what we're seeing, repeat ongoing violations, we can't continue to see these. So now we're going to require to work with a food safety consultant. So, we were able to have them do that. The consultants work directly with Cyanide, where they check in with us. They say, okay, they're doing better with this. So we'll continue to oversee that for the next 6 months and make sure that they maintain these food safety habits. And so that was one thing I wanted to mention. Yeah, so unless you have any other questions on those.
Yeah, I have 2 other things. One of them is that we started the permit renewal campaign for like the end of year permits. So those renewal reminders have been out in October, and we're in the process of reviewing those applications. And then we also had our first application for a new body art facility where it's just for microblading, and we're still in the process of opening them up. But we did the first initial pre-opening inspection.
Quick question about the Farmhouse. So pretty intensive oversight. I think weekly checks for 6 months, which I think is great. And then after 6 months, if they're in compliance and doing well with the
Yeah.
consultants,
So what we
does
did
it drop down to after that?
So when, like for New Garden, for instance, we did this with them. We brought them back in to meet with us. The owner and his daughter came in and we said, okay, after the 6 months, this is our assessments. We're still seeing some issues. What happened? And they said, oh, one of our managers, left. So then we said, okay, well, in order for us to see consistent food safety protocols being followed, we want you to stick with the food consultant for another 3 months. And then that's what we're doing with New Ireland. So same thing, if we felt they had not maintained and improved for those 6 months, we would bring them back in and assess that at that time. And so far, so good. They've been working with us on that, you know, as far as extensions, things like that. So, but it helps. I mean, this is really working, I feel. It's a good thing
Good.
that's going, yeah. So, yeah, we'll hope we'll Farmhouse will get back on track.
Any other questions? No. No. The owl is dead.
You're having all technical
Oh,
difficulties,
okay.
And unplugged.
There's the owl. Okay.
but Rebecca's here for traveling meals.
Oh, yeah.
Here we go. I'm already turning on right here. Right here.
You want me to give my update?
You're right here, because the only other one we have is accreditation, and I don't see, at least on our brief screen there, Allison or Lynn, so.
Okay, traveling meals. So for the month of October, we delivered 884 meals to 49 clients. We had one new client, no cancellations. We got some new COVID test kits in, so I included one kit into each of the client meal bags. And I promoted some programs within the town to the clients, the Cath shopping trips, the library materials by mail program, the iPad grant program, and the Thanksgiving meal day program from the Needham Community Council and the Needham Golf Club. So that's about it. Do you have any questions?
No questions.
No, okay, thank you, Rebecca.
Thank you.
All right, do we have any other staff on for the
We
reports?
do have Terry and Sam for shared services.
Okay, well, let's go there then.
I heard my name and then I think I was getting promoted, so it got cut off.
Yep.
Were you asking for me, Tim?
Yep.
Yes.
Shared service update.
Hi, good morning. So for shared services, we've been very busy getting started on deliverables for the program. Amy McInerney's been working with each of the 4 towns for completion of a self-assessment, which is kind of a midpoint review of what progress has been made since there was a capacity assessment survey done a year and a half ago. And we'll use that to guide the results of that self-assessment to guide, decisions among the advisory board about what other things to make as priorities. Sam Menard has been busy working on an inventory system for all of our supplies, which is also a deliverable. And it's an Excel spreadsheet and it's a little complicated and it's a little dry for some folks, but I think it's in good shape and it's an important underpinning for good practice. So that is going well. And then I think the only other thing I'll say is that we do have a visit with our project coordinator from the state on December 6th. And anyone from any of the communities in the advisory board is welcome to attend in case you'd like to meet our project coordinator, Jess Furland, and hear more detail about the deliverables, about the full work plan and the plan for the program. And with that, I'll see, any questions?
Yeah, will you send out an email reminding us of the December 6th date?
I'm sorry, could you say again?
Can you send out an email reminding us of the
Yes.
December date? Okay.
Yes.
And I have to say, I think that this group is gelled very nicely with the different boards represented, who all seem to be talking to each other and getting along well together. And I think we're making progress.
Thank you for sharing that, Ed. It's been a pleasure to work with the group, and I do see the group formation going well. So, and thank you for your contributions. Much appreciated.
And will the December 6th meeting be virtual as well as in person, or?
Yes, it will.
So, yeah, so someone's gonna join. Okay. Very good. Anybody else online?
Should be, I think all the team, you saw that Julie's, Tiffany put together the FE report. Julie is still out on parental leave, but should be back in the new year.
Right,
Um,
okay. Yeah, I think just leave was the only other one, public health preparedness.
yeah, not a ton to report on that front. The MRC has been, active. We have been responding to state drills. There's been a couple in the past few weeks. And there's been a lot of alerts to communities about red flag warnings, although what our Medical Reserve Corps can do about that is fairly limited.
That's all right. Very well. Well, we're ahead of schedule. So that gives us plenty of time.
Joel, just so you know, I'm on.
Oh, great. Thanks to Joel. All right, yeah, and already just arrived as well, so we got a full house now. All right, let's dig into the Metro West survey. There's a lot here to unpack when I reviewed this.
There is, and I want to begin by saying that this slide presentation was compiled by Julie McCarthy. She deserves full credit for all of the work that she put in over the summer to vet the most important data that she culled from each of the different categories. I am here today to largely focus on the substance use and mental health data, but you will see that this PowerPoint has, as I said, the salient points from all of the categories that Julie put together on graphs for us. So I could certainly try to address any questions you have about those other categories, but my particular area of focus is the substance and mental health. Kim, did you have plans to put that PowerPoint up on the slide there, or do you want me to just read from my?
I can do it.
Okay, great. Thanks, Dawn. So I'll dispense with a lot of detail about the background of the survey. I trust everybody here is pretty well acquainted with it, but the data that I'm going to share was the survey that was administered last fall to our 6th through 12th graders for the 2023 administration of this survey. And I do think it's relevant to point out that 25 communities now participate in this survey. We have a little comparison in this presentation of some of our NENA data to the Metro West region. So I'll talk about that in a minute. And then you'll see also the participation rate on this slide of the middle and high school grades, which is
Really
pretty
cool.
much on par with most of the surveys that are administered. So moving into the graphs themselves, this first one is the sociodemographic and other student characteristics for middle and high school. We show it mostly to let you know that these are categories that are identified on the survey, and we have a healthy proportion of these different categories of students. It also means that it allows us to be able to cull specific reports through the Metro West Adolescent Health Survey dashboard. That's a very new resource for us, and having the ability to cross tab between socioeconomic groups and some of the indicators in the survey has been really helpful. Moving on to the overall trends. This is really kind of a high level look at substances by type or split between middle and high school. And the equal signs, for example, on the left side for middle school for grades 6 through 8 show that there's been minimal change for vaping and cannabis use. I will tell you marijuana is stated here because that's the word that's used in the survey for the students. You'll hear me refer to it often as cannabis. On the right-hand side for high school by substance, while it's wonderful to see that vaping and marijuana use has declined for the high school students, I will caution you not to be easily misled about the down arrow for alcohol. So in 2021, there were 31.2% of this high school students that reported current use of alcohol, and in 2023, just a slight downtick of the 30.1. But our current use rate for high school of alcohol has remained somewhat static in the last 3 survey administrations. And alcohol clearly is the highest substance of choice among our high school students. And also too, I like to look at the number of students impacted, and in the case of misuse of prescription drugs, that 2023 data point of 2.7%, that's actually 37 students. The next slide, which is a trends over time of current substance use, you'll see, as I mentioned, alcohol use has remained somewhat steady, down, of course, from 2012, but still nonetheless in that 30 percentile. And cannabis and vaping use has been declining. But this gives us a little more of a snapshot over time. But in regard to vaping and cannabis use, you'll see on the next slide, we notice these declines, and based on anecdotal evidence of youth vaping, plus the increase in societal acceptance of cannabis, we wondered what could be driving this reported decrease. So when we look at questions regarding perception of harm, it appears that youth perception of harm for vaping products is high, and it increased slightly from the 2021 survey. And the perception of harm using marijuana has increased notably. So there you'll see that side-by-side comparison between that perception of harm and current use. We've highlighted those 2 substances in particular that I just mentioned, vaping and marijuana. On the next slide, we often refer to this because substance use does increase by grade. This is a lifetime use snapshot, but you'll notice, for example, this graph shows us by substance and by grade. For alcohol, for example, there's a huge leap between 8th grade reported use of 11.9%, that's that green bar, up to almost 32% in 9th grade, big jump there. And for marijuana or cannabis, you'll note, yes, a jump between 8th and 9th, but more notably between 9th and 10th, for example, and then another big leap for 11th and 12th.
Can I ask you about the prescription drugs?
Yes.
Because that dropped between the 11th and 12th grade, which doesn't seem to make a lot of sense unless there's a cohort coming up that is using a lot more, and a cohort that's about to leave high school that is not. I'm wondering what might have changed.
That's a great question, Stephen. I'm not really sure. We could maybe take a little closer dive at some of the by grade specifics, but I don't offhand have an answer for that, but I'd be happy to check into it a little bit.
Thanks.
So the next slide, again, we kind of look at perception of harm, but in this case, a view from across the grades from middle to high school. And in general, perception of harm does decrease by grade. You'll see some of them a little more precipitously dropping off, particularly when it asks about using marijuana once or twice a week. And then moving on to lifetime use, comparing high school use to the Metro West average. This is where I mentioned those 25 towns that participate in this. So Needham compared to the other 25 communities that take this survey, huge differential in alcohol consumption, current alcohol use, an 8 percentage point difference, which we think is pretty notable. And taking a look next at impaired driving at the high school level. So the 2023 survey asked questions relating to use of alcohol and cannabis and driving. So our percentage of students who reported driving after drinking went up a little bit, 2 percentage points from the 2021 survey. A little bit concerning to me. 5% rode with a high school driver who had been drinking. That is pretty static from 2021. As well as reported driving after cannabis use, 8%, which is similar again. 8%, by the way, is 108 students driving around community. 5% is 68 students.
And just because the previous slide was Needham High School compared to Metro West, is this slide Metro West or is this just Needham High School?
Needham High School. Thank you for asking. Yes, Needham High School. So moving into some of the mental health data, you'll see next a Needham High School report on stress and anxiety. We split out some of the mental health data. This one is particularly on stress and anxiety questions. So 31% of students report that their life was very stressful in the past 30 days. Females are more likely to report this level of stress than males by a considerable amount, 41% of females versus 20% of males. School is the most common source of stress. 71% of high school students report that, defined through grades, homework, tests, that kind of thing. And 36% of students reported that they experienced symptoms of generalized anxiety disorder. Now, this is down from 42% in 2021, but that 36% is still high, and we have a trend over time that we'll show you in a few minutes to kind of compare that. And the next slide takes stress and anxiety and compares high school to middle school. I will note that that's middle school for 7th and 8th grade. 6th grade did report on that as well. I have that information if you're interested.
Is there a reason why it wasn't included in this slide?
To be honest, I'm not sure exactly why we decided not to split that out.
Or why you did split it out?
Or why we removed 6th grade.
Yeah.
Some of it has to do with the way the reporting is done through EDC. It is an interesting thing to note. But I did track down the 6th grade responses for life very stressful, for example, was among 6th graders 10% compared to their 7th and 8th grade peers at 12.2%. And generalized anxiety disorder among 6th graders is at 17%. So certainly not insignificant.
If you wanted to report that, you just add another part in each of these with a different color.
Yes, you're right. We certainly can. Yes. And then moving on to depressive symptoms for our Needham High School students. We see some similarities from the 2021 survey. So 22% of students reported depressive symptoms in the past 12 months, similar to 2021. Intentional self-injury is reported by 12% of our high school students, which is down a little bit from 16%. 9% of students seriously considered suicide in the past 12 months. That 9% is 122 students. And 2% attempted suicide in the past 12 months, which is around 28 students. Concerning. The next slide takes depression and suicidality between high school and middle school. And rather alarming, middle school students report suicide ideality and suicide attempts at higher rates than the high school students. We've highlighted that there.
How about the 6th graders there?
So for 6th grade, 11% or 46 students reported that they seriously considered suicide, and 1% attempted suicide, which is 4 students. And 11% of 6th graders felt sad or hopeless almost every day. That's also 46 students. And 5% reported self-injury. The next slide, I find it's rather busy. And because of that, we highlighted in a red box there, the 2018 to 2021 and 2023 surveys. And that's where you'll notice, sort of that increase in the 2021 survey, which was the pandemic time. But even still, when we look at the 2023 numbers, they're still high, despite that, and some of them are even higher than 2028. I mean, sorry, 2018, excuse me. And actually, the next slide takes that comparison just a little more readily. Mental health patterns over time between 2018 and 2023. Almost all the indicators show similar or higher rates in 2023 when compared to those reported in 2018.
Yeah, I mean, when you go back to the historic norms, it seems really it's just feeling sad or hopeless. It's the only one that's really off.
That's that sort of purpley one there on the transfer time.
I mean, 2023 was also, it was towards the end of the pandemic, so, I mean, clearly the pandemic was really hard on
Absolutely.
our youth and mental health, and I think it's not reasonable to expect that as soon as we declare the pandemic's over,
That
then
it's
everything's
all
gonna
gonna
go
go
back.
back.
It's gonna take
Exactly.
time.
Yeah, the whole cohort of students who were freshmen or 8th grade, 7th grade,
Mhm.
were still in school,
Mhm.
and they still be feeling the effects of it.
Absolutely, coming through high school now and absolutely.
Yeah.
We take that data and we slice it out by sex, and you'll see on the next slide that there is a continued disparity between the sexes at junior high school. So female high school students reporting poor mental health at significantly higher rates than their male counterparts. All categories. And then moving on, as I mentioned it earlier about our ability to look at crosstab reports. This slide shows the intersection between substance use and mental health for our high school students, grades 9 through 12. And high school students reporting current or past 30-day use of alcohol or marijuana report poor mental health indicators, suicide ideation and or attempts at a higher rate than their peers who did not report current use. So this chart is split out by substance at the top, alcohol use versus cannabis or marijuana use, and then split out between those who report use versus those who did not.
I don't know if you have enough numbers, although for alcohol, you probably would. You split out by gender, and I'm curious about this intersection as well, because, I'm just wondering if the mental health is driving the substance abuse. And, you kind of have generalized here between users and non-users, but you should see a huge discrepancy between genders.
Right, is that increased use disproportionately
Yeah.
borne by,
Right, the female.
I was wondering that for that and the next few slides, like current lifetime. That would be, is that something that you broke out? Or I guess.
By
it certainly could be done.
sex.
Yeah,
I'm not sure we have it here. You just. No, but we could certainly take a look at that.
yeah, I mean, that would be really helpful to know, I think, in terms of targeted interventions, you may have.
Yes, yes, for sure.
Opportunities there.
So the next series of slides, for example, are nuanced between, so the first one we just came off of is current use, the next one is lifetime use between, looking at alcohol and cannabis use. And the one following that is lifetime use between vaping and prescription drug misuse. And we see that in general, students having reported any kind of use over their lifetime of any of these substances reported poor mental health indicators, particularly what we see here, or suicidal ideation or attempts. And they're than their peers who report non-use. And then there is one for middle school, grades 6 through 8 for lifetime use between alcohol and vaping products. You'll pardon me, the weapons and physical fighting slide should have come after the chapter division there where we have additional data. But I do want to just quickly, if I may, point to, John, if you wouldn't mind advancing to slide 28, it's the protective factors. Thank you. In our work, particularly in prevention, we talk a lot about increasing protective factors and reducing the risk factors. This slide shows that since 2018, there have been decreases in Needham High School students reporting that they feel that they have a friend they can talk to, feel that they are a part of a group of friends, have a lot in common with people around them, and feel that there are people who really know and understanding them. And supporting this, there have been increases in reported loneliness and feeling left out and excluded. And these increases and decreases, which we may have expected during the 2021 survey due to the pandemic, have nonetheless persisted. As we said before, it isn't likely that these things just go away rapidly, but they have persisted in the 2023 report. There have also been decreases in reported school connectedness in middle school since 2018.
So I wanted to just go back to that weapons and physical fighting.
Yes.
You have about carried weapons. Was the question specific carried weapon to school or just carried weapon
I
period?
believe the question, I can certainly verify, but I believe that question was carried to school.
Because if we have any carrying a gun to school, and it looks like we have 2% in the high school, that's a problem.
I'll double check that though. I don't want to misstate without double checking if that is the way that question was asked.
Right, thank you.
What's even more concerning is that carried weapons in middle school, and that's
Mhm.
pretty high, 6%.
Right, but they're not specific. I mean, I'm thinking, you know, a mass shooting here in town.
Yeah.
And if we have, you know, high school students who are carrying, you know, firearms into the school, we have an issue.
Yeah. Let me check that for sure. Just, I don't want to misstate anything on that.
Okay.
There's a lot of good data in these other slides as well. If there's any specific questions that you might have, I can do my best to answer them, but
Do schools have access to these results?
yes, absolutely.
They were presented to the school committee, was it 2 weeks ago or?
Yes, on the 15th, I think.
A week ago.
Yeah, because I'm wondering if it might be worthwhile. I mean, let's dig into some of those other numbers, but it might be worth our having a meeting with the school committee. Saying, you know, we've got some recommendations based on this for what you might want to consider doing in the school system.
That's a good point.
And are these results also shared in a public forum at all? Just for like, you know, the general adults or population of Needham, for parents to be aware of these results?
Well, we do our presentation of the data at our, sorry.
A little louder.
Okay. SPAN presents at our coalition meeting. We had that last month, for example, and the entire community is invited. And the presentation to the school committee is obviously a public presentation, but other than that, I'm not aware of the school presenting elsewhere.
Yeah, I mean, well, I know we've had articles about some of the deliberations of this group, but it just feels like this is information that the community should have access to and be aware of, which, I don't know how much they would be with some of those forums.
Right, absolutely. And these reports are posted on our SPAN website, as well as I believe that the school department posts them as well.
Yeah, it might be worthwhile, and, we can talk about it, actually getting this to town meeting in a very condensed form. But I mean, there are a couple of things here that I think we've highlighted that would be of significant interest to the community. And bringing that information to town meeting would certainly get everybody on board with what's going on. Better if we had some recommendations, based upon them, obviously, because it's like, okay, we gave you this data and now, we want to tell you what to do about it.
Right.
Also some intervention methodologies, whether it's with the school or within the town. Because even intervention methodologies as to how this could be reduced over the years, especially the alcohol use in middle school, that's very alarming. To think that there is a perception that you can have 1 or 2 drinks a day, even in middle school. Extremely concerning. Middle school is.
Right, but I mean, it could come with a funding request, for enforcement issues, it could come with funding, all sorts of funding requests. I mean, I don't think this, on the basis of this, at this point, we're talking about metal detectors in high school, but that's the sort of thing that, would go along with something like that if we did find it was a problem.
Right.
Yeah, or it reinforces the need to have, as Neven does, specific school resource officers that are assigned to schools.
Correct, or increase the funding for that because we actually need more because we're seeing a trend. I mean, these are the sorts of things that, we can get funding for the department and, again, hopefully prevent, death from suicide, from mass shooting, what have you. I mean, there's a lot of stuff, a lot of work we could do, and this bolsters our, our case for continued funding for these services.
Right, the mental health services, for example, the mental health services we've asked for, this very much validates why that's so important.
Right.
And also kind of to get back to Artie's point, just sort of targeted funding for alcohol. I mean, that big jump between middle school and high school, I mean, I guess you'd sort of expect that, but it's a huge jump. And, alcohol is just such a persistent problem. We've made some slow gains over 12 years. But then, we've got these big problems associated with it, like people driving 5%. And, targeting that group as they enter 9th grade, if you can cut that bar down a little bit, hopefully cut all the other bars down too. So that particular age seems like a
Absolutely.
point at which we could.
And getting this information out would also pressure the Board of Selectmen to be serious about enforcement or turn it over to us.
Yeah.
That's actually a good idea.
So
They failed for 12 years.
I know what I mean is using this data. To push that.
And you might be familiar, how I've shared about our Stop Act grant that we've had. This is our 4th year and last year of that grant. And its focus is on reducing underage access to alcohol and our strategies have been primarily through compliance efforts, through alcohol compliance checks and the responsible beverage sales and service training. But so while we've been grateful to have staff who could paid through the grant to focus on that aspect of underage access to alcohol, grants end and the sustainability has to continue, correct, to maintain the effectiveness of that compliance. So that's just another aspect of the community supporting the efforts that are in place and making sure that we can have that work continue.
And when-
yes, we're applying for another Stop Act grant,
Yeah.
but nonetheless, you know, the issue of sustainability of that work, I think is super important.
And remind me, when did we introduce alcohol to the town?
2013.
Yeah. The year before I started.
2013.
All right, because then, you know, you've got to compare stuff as well with the 2012 survey where we have data. Because, you know, did introducing it make a difference? You know, the trends over time by the communities would suggest no.
Right.
You know, that didn't really have any type of difference. And, you know, given that we have a huge discrepancy, Metro West versus Needham, I'd like to see the breakout for what happened with Needham specifically over time as we introduced alcohol into the community for sale.
I think when we look at the questions that ask students where they access their alcohol, that's particularly telling.
Mhm.
It isn't largely through retail means, for example.
At home.
It's at home
Mhm.
without parent knowledge. It's also, you know, through friends and at parties. Those are the primaries.
It's also through home. So I mean, it may be a parent
Yes.
education thing that we need to do.
I mean, we know we have that level of detail on access because all those questions, the questions on where you obtain alcohol is pretty detailed.
Yeah, I mean, it's pretty well accepted that if you have firearms in your home, that you secure them. But maybe we should put out the same message about alcohol, it should be secured.
And we have a tandem survey that our coalition administers to parents who have students in grades 6 through 12. And we ask them similar questions, including, you know, how do you secure your alcohol? How do you secure your other substances? Or do you? How important do you think that is? We ask questions to the parents of 6th through 12th graders to get their beliefs, perceptions, and attitudes around substances in all different fashions, from the way they communicate with their children to their practices at home around that storage and so on. So we think that that data combined with the Metro West Adolescent Health Survey data is it's a pretty powerful trove of data that helps guide our work, certainly.
All right, any other questions about the survey?
This is very concerning trend, as we have all acknowledged. I think maybe at one of the future meetings, we could discuss what the school and the town will do over the next couple of years. To actually start working on reducing these trends.
Right, I mean,
So,
this data is the community's data, right? It's the community's responsibility to work together.
But yeah, but let's see if for our next meeting, we can dig down into, you know, into some of the specific questions that we had. For the breakouts for Needham High School. That would be useful. Right? All right, and so we're still a little ahead, which is good, but fortunately.
We are a little bit ahead. Before we jump to our next topic, which I
Mhm.
think, you see Kathy here and I think
Right.
Rob is
Yep.
online.
Yep.
And I'll promote him to panelist. I wanted to introduce, Jen, our shared service nurse. Jen, do you mind telling the board just briefly about yourself?
I'm Jenny Gatter. I am the regional public health nurse. I came on board about a month ago, almost a month to the day, actually. And sort of been spending the last month in the nurse's office, getting to know about the programming here in Needham. I come from the Brookline Health Department, where I worked in substance use and violence prevention, so hearing this has been really interesting. And prior to that, I spent many years working in the community. So I'm excited to be here and join the team.
Welcome. I know Ed said that the shared service group is gelling pretty well. I think one of the happy things for us is Dover and Sherburne have made an offer and it was accepted by a candidate for a shared public health nurse, supported for both communities, supported partially with Dover money and partially with shared service money. So that's a big step because Needham has sort of been unofficially responsible for helping them when they're shorthanded, and they've been shorthanded for a while. So they're
stepping up a little.
Yeah, exactly. We do have as our next item Kathy Rise and
Mhm.
Rob Fernandez. Rob is online, but Kathy is here. Rob, if I'll try to promote you to panelist, if you want.
Yeah.
Morning, everyone.
Wonderful. Kathy, did you,
I have a presentation. Is that possible to be shown?
Yeah.
Please.
But is Rob just listening in or is he?
Rob is sick.
Oh, okay.
Yeah, so I didn't know if he had contacted you, if he was online and contacted.
It looks like he's listening, but
He's listening,
he
okay.
wasn't accepting a promotion to panelist, but that's probably why, and that's perfectly
Okay,
fine.
yes,
Yeah.
so I'm holding on the fort myself today.
Okay.
But thanks so much. Again, my name is Kathy Reyes. I'm from Green Needham Plastic Reduction Team. And today we're here to talk about really the plastic crisis and steps that we can take here in Needham to help have an impact on that. So the plastic crisis is certainly something that is upon us, whether we consider it from a climate change perspective, with plastic production having the fifth largest greenhouse gas. It was a country, it would be the fifth largest producer of greenhouse gases, or an environmental justice issue. We've got Cancer Alley, where in Louisiana, where there are a lot of plastics being produced, and the marginalized communities in that area are being impacted health-wise from that. Or from the other end of the spectrum, when we're trying to get rid of the plastic waste and landfills are being created also near marginalized communities. Or we can talk about it from a waste perspective. Plastic is not actually recyclable. It breaks down in the process. And the state of California has filed a lawsuit against ExxonMobil to that effect. Or we can talk about it from a health perspective and how microplastics and chemicals that are used to create plastic are impacting human health. So any way you look at it, plastics are ubiquitous and they are certainly an issue that we have to sort of deal with. So today we'd like to bring, are you able to actually show the presentation? That would be, because those are the bylaws, but.
So Kathy, the email I got for you had 6 Word documents, which I think are these. I don't know if I got an email that had the presentation.
Okay.
Or was it from Rob?
No, it would have been for me. I thought there was a Google presentation that was there as well.
Okay, sorry.
And if not, I'll just grab my computer so I can talk through it really quickly.
Yeah, I'm sorry, if you can pull it up as well. Oh, I see, it's a link, sorry.
I think that's right in that email, but.
No, if you can pull it up, I just sent it to you, there's a link in the first part saying slide presentation. I didn't even realize it.
Right.
They're looking for Outlook.
She's an Outlook. So we have all your Word documents there.
It was yeah. It was labeled Board of Health presentation 11/22. But I can.
But you start.
Yeah, sure. I don't want to, take up too much time. Do you want me to just forward the email again, maybe?
Nope, I got it.
You got it? Okay.
Can you?
Sure. So basically, we've drafted 5 different bylaws to consider several different single-use plastic items. And kind of, we're looking today for your feedback. We're early in this drafting process. And so just want to talk about some of the concerns and try to understand what we would need to do to get your support. So the first one that we are proposing is a ban on plastic NIPS bottles. NIPS bottles are too small to recycle. They're 100 milliliters or less. And they're often found littered among the Needham roadways, around town forest. I have a daughter who plays soccer, and they're constantly found around the soccer fields, which can be an uncomfortable conversation with a 12-year-old. So it's kind of gross, and it's a litter issue. And since they're not recyclable, they just really break down into the environment. I just want to be clear that currently as written, the bylaw does not impact glass NIPS bottles. You know, we're the plastic reduction team, and so we are just focusing on plastic, but would look to your feedback if that would be something that you would be interested in adding to the bylaw. So we did research with the 6 liquor stores that are in town. 3 of them currently sell NIPS. So Needham Wine and Spirits said it would negatively impact their revenue if we banned the NIPS bottles. Needham Center Fine Wines understood that NIPS is an environmental issue, and their belief was that people use NIPS to limit alcohol intake. Bin Ends does not sell them at all because they feel that they're a serious source of litter and encourage people to have alcohol issues. So they were in favor of a ban. So it's kind of a mix among the different stores in town. Going on to slide 5. Thank you. So there are 12 cities and towns in the state of Massachusetts that currently have NIPS bans. Most of them actually ban all NIPS, whether they're in glass or in plastic. But just 2 that I'd like to highlight is that Chelsea banned them, and that they have found really positive results from that. The city councilor said that the rate of alcohol-related emergency calls was reduced drastically. I think, more than half. So that was a really positive outcome. And then in Falmouth, looking at it from a litter perspective, when they banned NIPS, they went from being the single most prevalent item in their waste stream down at 32% down to only 6%. So there's some data to support that that's a positive change for the towns. Since I have 5 different bylaws, it's kind of up to you. We can either discuss each one of them separately, or I can go through my presentation and we can talk about them at the end. I don't know if the board has a preference.
I think it might be best to go through them all.
The whole presentation.
Yeah,
Okay.
'cause I think they are interrelated.
Perfect. Thanks. So the next one that we were talking about is a ban on black plastic. So in the past couple of years, it's come to light that black plastic is largely made from recycled electronic waste, which can contain heavy metals and flame retardants. And so when we are either cooking with it, or if hot food is being placed into takeout containers, those chemicals can sort of migrate into our foods. So black plastic is an issue from that perspective. Another issue with black plastic is that it is not recyclable at all because of the way the MRF recycling system works. There are lasers that sort of help to cycle through all of the different waste, and the black plastic literally absorbs the laser, so they're not seen at the MRF recycling facilities. So they go directly into trash. So that was why we were proposing a ban on all black plastic, including kitchenware, utensils. And there are alternatives to this. Restaurants, especially for takeout, can use white plastic or aluminum containers, or encourage people to actually bring their own containers if they have leftovers after a dinner out. I also want to point out that, that Newton already has a ban on black plastic, and, this is supported by the business chamber.
Is there a cost difference that you know about? Just-
There is a very slight cost difference, an increase unfortunately, for the white plastic containers, yes, but it is minimal. So if, like the chamber feels like there are reasonable alternatives, the chamber of commerce feels that there are reasonable alternatives to it. Yeah, the next, is a ban on plastic beverage bottles. And so what we have done is actually split a bylaw into two different parts, split this into two different parts. So we are offering a bylaw that is just a ban on plastic water bottles that's unflavored, 1 liter or less. And then a secondary one that's more kind of inclusive of all beverage bottles that are currently 1 liter or less. The reason we've broken the two of them up is because water, tap water is readily available. So there's a very easy alternative with that. And then, but we do feel, and we've gotten some feedback from businesses that it's confusing if we only ban the plastic water bottles. They've said like, well, what about other stuff, other bottles? Don't you have the same sorts of health issues with those?
You say tap water is readily available. Is it readily available on all of the playing fields in town?
It is readily available on most of them. Green Needham has actually created a tap map that highlights water fountains and water bubblers that are available around town. So there's one available at Memorial Field. There's one
There's bubblers, but how about water, like
There's
refilling stations?
fillers, yes. So there's a refiller and bubbler at Devasio. There's one at Memorial Park. And then I'd have to go onto the tap map, but we have listed out which ones are currently operating. And I've been in touch with the Parks and Rec. And so they are looking to kind of bring more of the fountains online. What happened is during the pandemic, many of them were turned off because of health concerns. And so 2 years, they were turned off basically for 2 years. And just because of New England winters, some of them aren't working just due to the frost. Some of them had, I guess, lead issues, and so they're changing out some of the pipes. So Parks and Rec does have a plan to sort of bring more of the fountains up. But the tap map also lists out it will list out more businesses that are willing to kind of fill water bottles for people. It lists all of the town buildings, so it shows if there are fountains available indoors as well, throughout. So they would be available throughout the year. And then the ones that are on the fields are available really from spring through fall. So, yeah. And so really the concern around the plastic water bottles and the plastic beverage bottles is, again, that plastic is largely not recyclable. What happens through the recycling process is that you've got a lot of the chemicals that are made to actually create the plastic, and the plastic carbon bonds break down throughout the recycling process. So when you have an initial water bottle, in order to recycle it and get another bottle, you actually have to add up to 80% virgin plastic in order to get another water bottle. So it's just otherwise too frail. So generally, plastics like that are downcycled into lesser quality plastics. We're learning more and more about microplastics and the toxic chemicals that can migrate into the actual beverage. So when you twist off the cap, microplastics can actually fall into the water every time people are kind of opening and closing those plastic caps. They're being exposed to more microplastics. And again, just if through the transportation of the water bottles or even other beverage bottles, if they're heated up, if they're on a truck or whatever, left out in the sun, the chemicals can sort of migrate into the beverage more readily. So those are just some of the actually on that, if you can go to the next slide. Yeah, so those are some of the issues about why we would look to ban plastic beverage bottles. Another huge issue is that plastic water bottles and beverage bottles are found on most of our playing fields. And so our Parks and Forestry Division, I spoke with Ed Olson, they spend up to 3 hours after every weekend, every Monday morning, picking up all of the plastic trash that's left on the fields from soccer and sports that are going on. And also when the kids have the half days at school, they say Memorial Fields is just can be trashed. There's just plastic all over the place that the kids are not disposing of properly. So it's a trash issue for us, a waste issue for Needham as well. And then the fifth and final bylaw has to do with Skip the Stuff campaign. This is also highly supported by the Chamber of Commerce, and they actually asked us to kind of bring this forth because this is a benefit both for restaurants and from a plastic reduction standpoint. So Skip the Stuff just means that like utensils, condiments, napkins, anything that sort of comes, accessories that come with a meal, especially for takeout, the patron has to request them, that they're not automatically added into the bag. And, one of the best examples is that, you often get takeout and there are utensils that get added into the bag. You bring them home, you're already using your silverware. And so they're not even single use, they're zero use. They literally go right from the restaurant into the trash. So this just asks eateries to on their websites to offer a list of all the accessories that they might and condiments that they might have. And if you're ordering online, you just click off whichever ones you would like or need. And or if you're at the store and picking up lunch or something, they could have a self-serve station. So patrons can just choose whatever products or accessories that they need.
Well, you also in the bylaw, and this is coming to, letting people choose what they need, that these would not be packaged, not sealed in any way. So
Say that again?
single-use accessories, including plastic forks, spoons, and knives may not be wrapped in plastic or offered as bundled sets.
Right.
So if I need a fork.
Yep.
How are we making sure that fork is clean?
Well, I mean, in so many restaurants, they're in the containers. I think we've been so used to the plastic industry pushing that it has to be wrapped in plastic in order to be clean. I'm not sure that you even really want to put a plastic fork into your mouth. So I would push back on that idea. But the plastic industry has done a really good job of convincing us all of it.
Well, no, but I mean, even if it's like a bamboo fork.
Yeah.
Right, which you would want it. I mean, again, how do we make sure that that's actually,
Sometimes they come in.
sometimes they come in a paper
Yeah,
sleeve.
paper
I've
sleeve,
seen that. Yeah.
There's also those dispensers. where the
Mhm.
Right.
Yeah.
So you can just kind
Restaurant
of.
pulls up and just tap
Yeah,
it.
it's just what I can
Yeah.
see is somebody with an ungloved hand, grabbing it and putting it into the bag, and that could be problematic.
Great, so, yeah, just, the last slide is, just talking about some of the latest, information and research that we've heard about, regarding health impacts of microplastics and, how they're breaking down on the environment and how they're impacting, humans and the food chain. So, there's research on nanoplastics inhibiting antibiotic absorption. There's a link between microplastics and liver disease. There is evidence of memory carcinogens with food content articles. So the endocrine disruptors that are largely found in chemicals that are used to make plastics. And one of the latest studies shows that there are microplastics that are infiltrating brain tissue. And actually, there's more microplastics that are migrating to brain tissue than kidney or liver. And researchers believe that is because plastic is drawn to the fatty lipids in people's brains. So it's concerning. And so we're trying, again, to just limit the production of plastic and sort of our consumption of it as well by these bylaws. So that's my presentation. So very open to discussions and
Okay, we have about 10 minutes for that. Okay, questions from the board?
So Kathy, is the plan that Green Needham would submit all of these bylaws for May 2025 town meeting?
yes, that's correct. Yeah.
And have you approached any other boards about this or had sort of public discussions about it?
We have not. You
Okay.
guys are first on our agenda. We're meeting with the select board in a couple of weeks. And you know, we're starting to talk to some of the stakeholders as well, but you guys are kind of our first step.
Okay, and Tim, you might refresh us, you know, the single-use beverage bottles came before us before, and we were a little reluctant at that time because of the need for water.
The need for water and then the concern about whether that would displace people into unhealthy choices if they, you know, they wanted something and they would then get a can of soda, for example.
Right.
I think that's still a question. But-
Right, so again, the ban is not on water. It's just on water that is packaged in plastic. There are, since we talked to you guys a year ago, there are so many more companies have been feeling the push for alternatives. So there are a lot more alternatives in aluminum that are available for stores to purchase. And the other thing I wanted to mention is there are 25 cities and towns throughout Massachusetts that currently have plastic water bottle bans specifically. And you know, people are still finding water. Again, we're really would push that people bring their reusable water bottles. And I know that's not always, people are not always able to do that. It's a behavior change. But the water that you're receiving in the plastic bottles is generally not as regulated as our tap water is in town, and we have really great.
That's for sure true.
Yeah, so, you know, that's kind of the educational part and push as well with this.
If we can go to one of the first slides that just lists the 5 proposed bylaws, just so we have that, yeah, there we go, just so, you know, I don't know if we want to discuss those maybe in order. But maybe that's the easiest way to go about it. So plastic nips bottles.
I could see that. They put them right by the cash registers. And I think that probably, given the issues we're seeing with students in the high school and alcohol, price of a nip bottle is what, $1 or $2.
But they're not the ones purchasing them.
No,
in the
they're not,
stores,
but
right? They're getting it
they're
from mom
probably
and dad
getting
at home.
somebody to do it for them. You know, and, you know, let's say they have less money than their parents, they can't afford a $30 bottle of whatever. So they, $2 bottle, little bottle is, you know, so, and you say, you're finding them all on the playing fields and everything else. Who's drinking it up by the playing fields?
Right, but if it's a safety issue, would we be supportive of a ban on all nips bottles, not just plastic?
Well, I think
But
it should
glass
be
as
all
well.
nips bottles.
And then
Glass
given the town's, you know, response to alcohol regulation in the past, how likely is that to pass?
It's a fair point. I thought one of the interesting things in the slide deck was the sort of 2 sides that the NIPS approach got from Chelsea versus Falmouth. In Chelsea, I think you said a former city councilor said, yes, it has improved the look of downtown with less litter, but we did it primarily for alcohol related issues. And they found some data to support that it had a positive impact.
Exactly.
In
yeah.
Falmouth, it was very much in the
Litter.
cleanliness, public litter,
Yeah, because
Right.
I mean, we,
Both of them.
yeah,
I mean, they're positive. Both of those are positives, you know, from our perspective, we're looking at it from a trash issue. Just because that's what we do. But the health impact is, you know, is also something that's there.
because I would suggest, you know, that we might be supportive of a ban of all nips bottles. You know, and if the town chose to limit that to plastics, you know, well, at least that's part of the way there.
Okay, but
Yeah,
yeah, I mean, I think if we're gonna do it, just go whole hog.
In general, I believe that is what other towns have done as well. The glass bottles are actually also not really recyclable because of their size. So that's what other towns have done.
And the black plastic, and it was kind of the first time I've heard that, but, there's lots of alternatives to black plastic. Some of them aren't necessarily too good, but.
Yeah, but I've heard a lot more of that data coming out of it, like, it's been recent, it's been like the last 6 months to a year. That data have been coming out.
I guess I missed that, but.
Same in the context of like black plastic utensils like spatula or.
Correct,
Right.
yeah. Basically it's contacted heat, but you know, those reusable containers. Are not really, it should not really be reused, for starters, and certainly not in a microwave oven where a lot of people are just reheating the leftovers, right in the plastic.
I've done.
Yeah.
Please don't. Research shows it's not good.
I won't now.
Yeah.
But I think it will be useful to just hear a little bit more about the biodegradable alternatives that we would like to propose when we ban the plastic or the microplastic. There is no two ways that microplastics are bad for health. But when we propose or when we support this ban, it would be good to know what are the alternatives that other towns are using so that people can start switching to those. So the implementation becomes a little easier.
Sure.
On our end as well, because I think when I look through the list, it's almost everything is a day-to-day item that we would use. For example, the plastic wraps, you know, the containers that we're talking about. I think plastic bottles are the easiest ones. I already see kids kind of using the water bottles, like the stand-up cups, for example. Those are like the most popular things right now. So
Absolutely.
those are the easier ones, I think. But the day-to-day items, switching out of those would require us to propose new alternatives. So maybe existing towns have done those, implemented those bylaws, and it could be nice to know, you know, what are the alternatives that we are gonna give to the folks in the town, so that we are then supported by the community.
And I'm also just wondering, in terms of the black plastic, are manufacturers responding to that? I mean, for some, that's a pure color choice. Right now, we know that, you know, in order to infuse that color, it's causing all sorts of problems. Have they responded, you know, in a way that, you know, hey, you know, you can buy this black spatula, and this one we certify is actually clear of heavy metals and all of that. So, I mean, as it stands now, I would be in favor of the black plastic ban, but I think that's one that, you know, we should be willing to, you know, continue to evaluate the evidence and perhaps change, you know, if the industry changes.
Sure.
And you said that is currently in place in Newton,
Yes, it is.
and
Yeah.
Was there any, what was the response from the retailers?
I would have to go back to Newton just to verify, but I mean,
It sounds like the price difference, as you said, is.
it's minimal, right, for white plastic instead. Their bylaw does specifically say black plastic, but they basically banned anything that's not reusable or recyclable. So I mean, the retailers have been in the process of switching over in the past. I think they put it into effect about 18 months ago. So I can check back with them to see how that's going, but in general, it's supported by the chamber, and there are plenty of alternatives available. It gets a little bit dicey when you talk about the like bioplastics or compostable ones, because there's a lot out on the market that is greenwashing. And so we could certainly, and I believe Newton has done the same thing, come up with a list that is alternatives that, you know, that are certified and have kind of gone through rigorous testing to offer to the restaurants. I think that's a great idea.
I mean, certainly to get rid of black plastic, that's like the worst plastic, but
Right.
the containers that people take home from restaurants and things, that's still a lot of plastic that's out there.
It absolutely
So
is. Yeah.
maybe the idea is to move towards no plastics and these containers.
Yeah, that would certainly be the goal. And you know, maybe that's a process over time, but just the research that's come out specifically on the black plastics and how it's the electronics that are being used to make the black plastic that we are then putting food into is the big concern. So, and the white containers do have a slightly higher possibility of being recycled or downcycled, at least through the waste stream. So, but you're absolutely right. We would love to.
Kathy, is there any plan, if these were approved, to have like a phase in or a period for essentially operators to spend down their existing stock?
Right now, the bans as listed are all proposed with a January 1st date, so
start
twenty
date.
twenty-six.
Okay.
And so, I mean, they would be
7 months or
7
6.5
months, exactly.
Yeah, give people time.
And we could work, certainly, based on feedback from you guys on making sure we are educating and working with the
Sure.
with the restaurants as
Makes a
well.
lot of sense.
So,
And then the final is the plastic bottles.
I mean,
I
I
don't
think
have a problem with that. I think there's lots of alternatives that can be used. So. And then you do see plastic bottles everywhere. On the streets and then,
You know, see aluminum bottle, aluminum cans everywhere
well, I
too.
know.
And you're trading one for another. To some degree, just in terms of the ways.
Unless you put a deposit on, that helps.
Mhm.
But then there's people that come along and pick them up. You drop it.
absolutely.
Liquid Death was
Hoping for the bottle.
and I think still is the major manufacturer, but I have seen there are more with aluminum options at this point than there were the last time that we looked at
There's
this.
wax paper. Containers too for water. And the heavy wax.
Which can be
The-
recycled.
Those can't be recycled, and unfortunately, it's not wax, it's actually a liner of plastic. Yeah, so they're mixed materials and they're not recyclable at all.
Yeah.
Yeah, unfortunately, I wish it was wax.
certainly that one might be interesting to understand if it did pass, what sort of renewed commitment or investment the town would make in additional public water fountains and or
Mhm.
water bottle filling stations.
Right. But we would need to see that commitment, and maybe that's something you talk with some of the other boards like Park and Rec and the select board with.
Right.
Yeah, even public work. Yeah, they will end up probably actually doing the maintenance.
Because, one of my pet peeves about like professional sports, for instance, is, there's no, I mean, they want you to buy the water, right? So they don't have water fountains available, and so you're buying the plastic bottles. I saw this when I was a doc with the Red Sox, because we would have people come in for, heat exhaustion and, and dehydration and what have you, during hot days, and that's because the only water available had to be purchased.
Right, and it's like $7. So, yeah.
So we want to make sure there are alternatives. Any other questions? If not, thank you. Good luck with this.
Great.
Be
Thank you.
happy to hear you back when you have some more details.
Yes,
after
we're happy
looking at
to
the other
do
boards.
that.
Yeah.
That's great. Thank you very much. Appreciate your time.
Thanks, Kathy.
All right.
We'll include in the posted packet online, the presentation. I had missed it. It wasn't attached, it was linked.
Ah.
So we will send it to the board and we will include it in the packet that's posted online.
Perfect. Thank you so much.
Thank you.
Thank you.
Mr. Chair, we have 3 hearings.
Yes.
We said that nicotine-free generation wasn't going to start until 9:25, so maybe you want to continue, so it's not really opening, it's continuing the synthetic drug hearing to start with, because that was 9:20 on our clock.
Okay, yeah, I think we're gonna have let's hope we have some time at the end
I think we will.
for that. All right, fair enough. So we'll continue that. But let's open the hearing now for Article 1, regulation affecting smoking and sale and distribution of tobacco products in Needham.
So it is a public hearing, a continued public hearing. And if there are members of the public or interested parties that want to speak, they could raise their hand. Dawn, if you can monitor online for me. I did want to draw the board's attention to, and I just sent it this morning, it was sent to me yesterday. The select board sent a letter to the Board of Health through me, expressing some concerns and questions about the nicotine-free generation policy. I did send the draft policy to the planning board, the Council of Economic Advisors, and the select board, and said, the board has a public comment period. It's many months long. You're welcome to comment as a group if you wish, or if you individually want to, write an email or attend, you could do that as well. The Council of Economic Advisors discussed, weren't necessarily thrilled about it, but decided they didn't want to take a position. Planning board didn't want to take a position. The select board wanted the town manager to put in writing their concerns, which included questions about whether, a number of the arguments, in the submitted testimony was about sort of youth substance use prevention, and they were making the distinction that, you know, we have tobacco 21 and the people under 21 are youth and people over 21 are adults. You know, I think there's certainly some question about, you know, risk processing centers of the brain and the age at which someone first uses addictive products and whether they become addicted, but that was one of their concerns. They had a more general concern about, you know, sort of the effectiveness of regulations. If people don't think the regulation is, you know, legitimate or serious, then they're going to respect regulations and the law less overall. You know, I heard all of those comments. I didn't push back on them. One or two of the comments that I thought made a good deal of sense were Kathy Dowd, one of the members of the select board, you know, asked about Brookline's experience and if they've noticed sort of substantive changes. Brookline unfortunately doesn't have the Metro West Adolescent Health Survey, but they do a youth risk behavior survey. And so I believe from talking to Brookline's commissioner that this year they're going to have their first post implementation YRBS,
Yeah,
so
it's
that
too early.
within, you know, 6 months or something, they should have data about whether there was an impact, you know, over that 3-year cycle. So that was a good question from the select board, but the answer is that they don't have data yet available on.
I think that data is going to it's going to be a long time in coming.
Yes.
Because, you know, younger people have access to nicotine through people that are a little bit older than who can currently buy. And, you know, as we've talked about before, as that group ages, you know, the 30-year-olds are not going to be buying nicotine for the younger people. So it's, you know, 1 year to another may not make that much difference. I would expect in the data.
That's part of the point of the policy.
Yeah, in a decade, it might be a big difference, you would hope.
And we do know, at least in Needham, and we're working to change this, that we have great data on the senior population, and we have great data that Karen presented from the Metro Adolescent Health Survey on 18 and under. We don't really have great data from, you know, the young adult to, you know, almost retiring adult age. We really don't, we have that missing middle of our data.
Of course, it's unfortunate they chose the day before our meeting. Well, we've had an open hearing ongoing for more than 3 months to submit any comments.
It is. Yes.
Yeah, so I'm looking at this and, you know, and I think we might be able to address these. So they list, you know, specifically 4 concerns. So the letter was sent by Tim at 8:03, so after we opened our hearing today.
Okay.
And I didn't get it until yesterday, but I
Right.
apologize.
Yeah, no. I
Yesterday
mean,
afternoon.
even so, we need to have a deadline of at least 24 hours prior to our meetings where we're not going to accept comments, you know, further, because we don't have a chance to process those prior to the meeting. But, you know, one of their concerns was that this is aimed at making sure young people don't have access to nicotine products, and this doesn't actually, you know, address that issue because those under 21 are already prohibited. I would say it's not just about preventing, you know, nicotine under 21. It's actually about the health effects, you know, downstream and all of the, you know, health insurance premiums that all of us are paying and lost productivity and the like for generations beyond that. So this actually affects adults as well, and it's a public health issue. Second was that regulation prohibiting the purchase of nicotine products by adults is out of sync with other additive and intoxicating products such as alcohol and marijuana, which are regulated by the Commonwealth. That's in the purview of the Board of Selectmen in this town, the Select Board, and they could choose to do something about that. Thus far, they have not.
The vice chair did ask, you know, politely, I think, you know, why this would be enforced for nicotine and tobacco products and not for alcohol and other things. And I did sort of say that I believe strongly in health in all policies, and I think the board would be very interested in getting involved in regulating other substances. So it was an interesting sort of juxtaposition, I guess.
Right.
Perspective there.
You know, the third is, as Tim stated, is that the passage of regulations that don't appear to be, you know, effective or unenforceable may somehow diminish respect for the law in the general population. And finally, whether the fine structure contained is allowable under current law, which we know it actually is, because you know, this has already passed the muster through the Massachusetts Supreme Court.
Right.
You know, It's interesting that they, you know, credit the town for being first in the nation for tobacco 21, but as I recall that, and you were there for that discussion, Ed, and I was not, that the select board was adamantly opposed over tobacco 21.
I sent a board member to about a year's worth of our meetings, monitors to make sure we didn't do anything else.
So and those are the 4 specific concerns in that letter. I don't know, I mean, Terrence said this is really your show, right? So
We do have a.
Yeah, I mean, I think, do we have any comments to add on that? I mean, I think it's definitely something, you know, with Karen's data and things, we look at that, you know, being a concern. So.
I did hear one comment because I watched, I was here for a while and then I watched the rest of it on television. One of the select board members thought that this was a form of prohibition. And prohibition generally has been proven not to work. I think that it's a possibility that people would go to other towns and buy cigarettes. Probability, yes. Until other towns adopt this as well. You know, we heard that argument
tobacco
a long
21
time ago when we did tobacco 21, and now it's a statewide mandate. So, yeah, you could look at it that way, but I don't think it's in the long run that's necessarily valid.
And I think just prohibition is quite different from tobacco-free generation in that prohibition stopped alcohol purchase for everyone when it was something that was accepted by at least half the population. And you were taking it away from people that had that right to do already, but tobacco-free generation is not doing that. So I think it's quite different.
We do have two people who are interested in commenting online. Stephen Heffer. Stephen, do you want to?
Yes, I would like to comment. Can you hear me?
Yep, we can hear you.
Yes, you can just tell us where you're from, which
Cambridge City. I am from Cambridge, representing Cambridge Citizens for Smokers' Rights. We received no funding whatsoever. This September, the Centers for Disease Control reported that teen cigarette smoking is at its lowest on record. Teen vaping is at a 10-year low, and teen use of nicotine pouches is under 2%. FDA Tobacco Product Director Brian King stated, "The continued decline in e-cigarette use among youth is a monumental public health win." Gallup reports U.S. adult smoking is at an 80-year low. The CDC confirms this by noting on its website that for every 3 persons in the U.S. who have ever started smoking, 2 have quit. When youth and adult tobacco and nicotine consumption is in such decline, burdening store owners with new onerous restrictions seems uncalled for. Many of these owners are immigrants of color who put in long hours and depend on small profit margins. This proposed regulation would hurt and devalue their businesses. A generational tobacco and nicotine ban does not apply to youth, but to adults 21 and older. Store owners already face $1,000 fines for selling these products to persons under 21. Such a ban is very similar to prohibition because it would mean in several years that a 30-year-old combat veteran could not buy a cigar, while 20-year-olds would be free to buy alcohol, marijuana, and scratch tickets, as well as vote or serve in the military. To most Americans, I believe this would sound unreasonable. One last comment. For years, tobacco researchers have warned that it is not the nicotine that is harmful, but the tars and other materials in tobacco that cause disease. Nicotine itself is a mild stimulant. It does not interfere with driving, impair judgment, or create social problems such as alcohol, marijuana, or opioids do. I put to the board that this proposed ban needlessly abridges adult liberty and serves no critical public health need. And I respectfully ask you not to pass it. Thank you.
Thank you.
Thank you.
Mr. Chair, I forgot to remind folks, but Stephen stayed within it.
Time limit.
The time limit is generally 3 minutes for people. Stephen stayed within that time limit. I know Lynn, the board has asked in the past if staff have opinions on this. I know Lynn wanted to make a comment as well.
And I would too.
And,
All right.
okay. and
Do we have
Karen,
somebody from the public as well?
Sure.
You said we had two comments from the public. There was Lynn the second.
I think Lynn was the second online,
Okay,
and then
all
I think Doctors Winnicott and Hartman also were interested in making, and so we have at least 3 in the room as well.
Okay, very good.
So maybe we go to Lynn and then we can welcome other folks to the table.
Sure.
Okay. Lynn?
Shall I begin? Okay. My comments may come as a surprise to some of you. I'm going to make some strong statements against nicotine-free generation, but first want you to know the context from which I speak. I've worked in various aspects of public health for almost 45 years. One of my previous roles was as Director of Community Health Programs at Cambridge Public Health Department, where I actually worked with Stephen Helfer, who just spoke. And among my responsibilities was overseeing a tobacco control program, which included prevention and cessation. In 2002, I was among a handful of leaders who started the Clean Air Works campaign, in which Cambridge partnered with 18 neighboring communities to advocate for and ultimately achieve smoke-free workplaces. The most challenging and engaging part of that work was closely working with restaurant and bar owners, wait staff, and bartenders, because their workplaces were among those to be regulated. During that time, we heard many of the arguments you've heard against nicotine-free generation. What ultimately moved our communities and then the state, and then ultimately the state of Mass, was that smoke-free workplaces were like other workplace protections against exposure to harmful chemicals. Clean Air Works protected workers by limiting their exposure to secondhand smoke. It protected those who chose not to smoke tobacco as well as those who smoked. I was and continue to be very proud of that work. But nicotine-free generation feels different to me. Nicotine-free generation seems like overreach. Banning tobacco use for future adults under the guise of protecting youth is de facto prohibition. And the fact that we are considering prohibition at the same time that we, as a society, are also considering decriminalizing the use of other substances that have previously been prohibited is rather ironic. I have to ask, what's the goal of this proposed regulation? We've heard many people speak in favor of nicotine-free generation as a means to reducing youth nicotine and tobacco use. But this proposed regulation goes well beyond the goal of preventing underage use of tobacco. That's already addressed in regulations restricting sales to people over 21. Nicotine-free generation is not about preventing youth from using tobacco. It's about controlling the decisions people will make as adults. The prospect of limiting the choices of a 26-year-old or a 45-year-old in the future does not sit well with me. Nicotine-free generation is paternalistic, and it may be an example of some of the larger criticisms we hear about public health in general, as if we are acting as the nanny state, preempting personal choice in the interest of a larger good, which we define. It feels moralistic. And in this time of laws and legal decisions based on certain moralities, it is particularly worrisome to me. There has always been tension within the field of public health between balancing community benefit and disease prevention with respecting individual rights. And this tension has always been played out in the theater of tobacco control. Whatever decision the Board of Health makes regarding nicotine-free generation, I'm confident that you will do so, that you will take that balance into consideration.
Thank you.
Okay.
Thank you.
So we do have, maybe we could make some space for Doctors Hartman and Winnicott. And then
Ginny Cather.
Ginny, you could also come up if you'd like. There also are some additional people online who'd make comments, so maybe we go to the people first in the room and go back to online. That makes sense to the chair.
Thank you very much for allowing us to speak. I have a couple of things to add to my testimony from last time. I don't want to rehash old areas, but I want to make sure that we bring everything to bear here. The personal choice and freedom is really about someone who is not yet addicted to a substance, having the freedom whether or not to choose or not. We know 95% of tobacco addiction begins before age 21. And that's always the struggle between the tobacco industry and public health officials. With 95% starting before 21, once you're addicted, there is no choice. You don't have a choice as an adult. Tobacco industry knows this. That's why they keep coming up with new products. That's why we have the new disposable products, which have 10 packs worth of nicotine in them and can be shared at a party. It only takes one of these to be passed around to start the addictive processes and to take away the lifetime choices of adults. So it is about freedom. This ordinance is about making sure people have the freedom to choose a life of not smoking and not using tobacco products. Lester and I have over 100,000 patient visits under our belts as pediatricians at Mass General and Boston Children's Hospital. We want to emphasize the effects of mental health that nicotine itself brings, because we heard that maybe nicotine isn't the problem. Well, nicotine itself leads to lasting brain changes. Nicotine is associated with worsening depression in youth, anxiety, ADHD, and suicidal ideation. Nicotine exposure increases the transcription of proteins that potentiate reward for other addictive substances such as cocaine, opiates, alcohol, and methamphetamine. This accelerates the addictive processes of these other drugs. I wanted to say that in regard to the question of the adjacent towns, Needham has run this experiment, and when Needham alone raised the sales age year by year to 21, Needham saw a 50% reduction in youth tobacco use. Nothing in public health works that well. This will have anticipated to have a similar effect. I'm from Brookline. I can tell you it's been night and day in terms of what we saw a few years ago versus what my child in the high school is seeing now. The border cities and towns of Newton, Wellesley, Dover, Westwood, Dedham, and Boston will be thrilled that Needham takes this action. Paul McMurtry at the State House, who represents Westwood, Dedham, and Walpole, has already agreed to put a state-level bill in place. He chairs the Joint Committee on Community Development and Small Businesses. This is exactly the right representative to bring such a state-level bill. With all due respect to the council members, I think we need to look overall, and I'll conclude with this, at the harms that this product has brought to society. Tobacco industry and these products have wrought quite a bit of harm. In fact, tobacco has caused the greatest health detriment of any consumer product in history, causing more annual deaths than AIDS, alcohol, car accidents, illegal drugs, suicides combined. And in fact, tobacco causes more deaths each year in the US than the number of US soldiers who died in all of World War II, each and every year. Nicotine-free generation does not take away personal rights or freedoms. It phases out the sale of a dangerous and addictive product over years, just like asbestos, trans fats, and lead paint. Those are all things of the past. Nicotine-free generation is about protecting our next generation, future generations from the known harms caused by the impact of nicotine dependence on the mental, physical, and financial health of our population and of our community. And the value of this freedom from tobacco dependence will be immeasurable. And those are joint comments from Lester and myself.
Thank you.
Thank you. Thank you.
I will add one thing. When I was young, a kid, my mother used to buy this stuff to spray on her rose bushes to kill bugs. It's called Blackweed 40, and it was nicotine sulfate.
Yeah.
So.
Yeah.
Needham, Massachusetts. I kind of want to pinch myself that I'm
I'm
here.
sorry, yeah, well, if you could just identify yourself and where.
My name is Ginny Chadwick,
Mhm.
and
Are you a
I
resident of the town?
am not a resident of the town. I came to the Boston area in 2021 to do my PhD at Brandeis. I am from Columbia, Missouri, and I live in Somerville, Missouri. And I think that my life's work has been because of Needham, Massachusetts, and these two men sitting beside me. Sorry, didn't realize that would make me emotional. I was a select board member in Columbia, Missouri. We don't have board of health. So we have to take the brunt of passing health policy. And I was actually one of the first bill sponsors of the Tobacco 21 policy in the country. And then I worked across the country to help bring Tobacco 21 to communities. And I want to say thank you to this board, because this board is what brought Tobacco 21 to our country. To be totally frank, and it took 5 years to get the data from Massachusetts, and I remember getting the raw Excel spreadsheet data. That was what was sent to me as a select board member in Columbia, Missouri, saying this works. New York City had just passed it. It was the 8th place in the nation to do it. And I said, let's do it. And we took a lot of crap for it, right? I had death threats. But I worked across the country to move that policy. And I just want to say it's because of Needham's leadership. And so I just want to encourage you to continue to lead. You're not going to be the Needham, Massachusetts, of Tobacco 21 because Brookline did it for you. But you can join Brookline now in supporting them moving forward to be part of that nicotine-free and 8 other communities. We testified at Chelsea the other day and is super supportive board that's gonna decide whether to vote on it next board meeting. So, I researched tobacco and I am the co-author of the Decriminalization of Tobacco Products national document that's co-sponsored by 45 national and statewide health organizations. And it is about not criminalizing the purchaser for tobacco products. The last thing that I would be doing is testifying on a bill that I think is going to criminalize or harm desperate populations in any way. But this is a phase out by putting the penalty and the onus on the seller of tobacco products. We are not harming or putting this policy on the purchaser, but really phasing out the sale of an industry that specifically targets young people to become addicted, but people don't start using tobacco products at an older age. We know that this is young. We know it's coming from social circles. We're going to slowly phase that out with this policy. And so I just want to come here and say, first, thank you, Needham. Thank you for what you did in leading in the past. And I look forward to you joining the 8 other jurisdictions and growing. Somerville had a hearing on it last night as well. To become a nicotine-free generation. And I also want to say that cigarette butts are actually the leading cause of litter, of plastic litter. And so as you think about the impact of all of the things that you're considering, and to the speaker's point on business value, if your business is set up to sell and profit from a deadly addictive product, then we should reconsider what our businesses are set up to do.
Thank you.
Thank you.
Okay, we have online Kate Silva.
Okay, do we want to do, Karen,
Oh,
had some comments you wanted to make?
we have Kate Silva, Anthony Chu, Karen, and Carol. So I guess if I could ask people to be a little briefer than 3 minutes, so we have time to finish. Everybody.
Thank you. I'll try and do this in 1 minute. My name is Kate Silva, and I was a co-sponsor of the Brookline bylaw. And I have, needless to say, have a ton to say about this policy, but I did just, given that you have wonderful health testimony from Dr. Winikoff, I just wanted to speak quickly to the retailer situation in Brookline, because it might be of interest to you. All of the retailers in Brookline are still open. It didn't change anyone's ability to run their business. And I think the reason for this is that this bylaw is designed in a way that is so very gradual. And primarily that design is to be compassionate to people who feel they need to buy nicotine because they already have a dependence on it. And that's really the important thing about this bylaw. But that's also helpful to retailers because unlike the flavors, which come off the shelf overnight, this is an extremely gradual phase out. And I think just our experience in Brookline is that the retailers have been fine since this passed. And I'm available if you had any other questions about Brookline, but I'm extremely happy that you guys are considering this. Thank you very much.
Thank you.
Thank you. Thank you. Anthony?
Hi, everyone. My name is Anthony Choi. I just can't seem to turn on. Oh, there's no option to turn on video, but my name is Anthony Choi. I'm the health director for Melrose, Wakefield, and Stoneham. I want to say thank you to the board for giving us this opportunity to consider this policy. Melrose, Wakefield, and Stoneham have passed this policy, and I'm not going to take this time to reiterate a lot of the points that have already been made today, but I just want to remind the board that the industry targets youth, and I've heard this from several others. Their goal is to create new customers. The tobacco industry relentlessly creates new products, synthetic nicotine, vapes, nicotine pouches. We have so many examples of the industry innovating to create new products that appeal to younger people. Most people start nicotine addiction, tobacco addiction before 21. They usually get these from their social circles. And these could be older siblings, older friends, usually in your 21 to 27 range. This policy is far from prohibition. This policy is a slow phase out, and this creates a gap. This actually prevents those people from getting these products from their social circles, from older friends, and this will eventually create a large enough gap where that's less likely for them to access these products. And I think the other thing I heard today that I wanted to address was the personal freedom question. I think lots of people like to talk about how this takes away freedom from people and they can make their own choice. For those of us who have worked in substance use, prevention, and treatment, addiction is not a choice, it's a compulsion. And we want to talk about how this is the mask that they're putting on nicotine products, and they're saying that this is a choice. But this is no more than just an argument to create disillusionment around choice. People who use nicotine products find it the most difficult to quit out of any other addictive substance. And so the industry is trying to find a way to justify this. And we need to be able to distinguish that from other issues. I want to say the board is very brave in taking this issue on. It's not an easy step. And I think there's a great history of tobacco prevention, tobacco control. I want to encourage the board to consider its duty. Its duty is to protect the public health at the end of the day. Thank you.
Thank you.
Thank you.
Karen?
I thank all the people who have spoken before me, and I don't mean to be redundant, and I'll try to cut out the things that might be, but I'm speaking today in my capacity as a substance use prevention coordinator for the Public Health Division here in Needham. And as a public health professional, I've been entrusted with the responsibility to support and protect the health and safety of the youth in our community. And we know as preventionists that upstream prevention works. and limiting access to substances is an effective strategy in combination with other prevention practices like education about the risk for harm. But my work is also about looking at the data and the science. So just a quick, hopefully not redundant, look at that data, that more than 480,000 people in the United States die each year from tobacco use and exposure to secondhand smoke. And over 36 million adults use tobacco products, and 700, and as of 2024, 760,000 middle and high school students smoke combustible tobacco products. So while we've heard previously that those rates have been on a decline, we still have an extremely high number of young people using these products. And yes, our country has a precedent for banning products that are determined harmful to the public. Lead paint and asbestos, as pointed out earlier, being examples, but yet tobacco remains accessible despite being the leading cause of preventable death in the United States. And yes, Needham has been a pioneer with Tobacco 21, for which we are extremely grateful and proud. But a nicotine-free generation policy for Needham would position our community one step closer to the end game of preventing future generations of young people from legal purchase of nicotine products. And as we have heard, it is not a prohibition on individual consumer possession or use, nor is it a prohibition of sales to adults who are current users. It is, as spoken earlier, a sales-driven restriction of nicotine products to future customers, future generations. I believe most people want to protect the health and safety of our children. I certainly do. And then finally, regarding its impact on personal choice, yes, we've heard about the addictiveness of nicotine. That first puff is known for many to take away that choice, as has been stated. And science tells us that nicotine is one of the most addictive substances, comparable to the addictive mechanism of heroin and cocaine. So yes, the phased-in approach of nicotine-free generation as a policy would reduce those initiation rates, especially among the young whose growing brains are so susceptible to addiction. And one final thing, if I may, I would add that in considering the implementation of a nicotine-free generation policy, we should consider pairing that with a commitment to help people quit. Culturally sensitive cessation programs are needed for all people to live a healthy and life free of disease caused by tobacco products, especially for those most burdened by nicotine addiction, as we know the disparities in nicotine health harms impact individuals depending on their race, ethnicity, sexual orientation, or gender identity, or socioeconomic status. So thank you for considering the data and the science, and I hope you'll consider bringing NFG as a policy to our town.
Thank you.
Any other comments?
Carol wanted to make a comment.
Carol.
Thank you. There's no way to capture all the facts and science that have been shared during the past few months and again today. I just want to say that I started in Needham in 2016 when this board had made the brave and informed choice 16 years ago, 18 months prior, to be the first in the country of Tobacco 21 purchase prohibition. And I saw this board go through the ups and downs in the public speaking. But the bottom line is Dr. Winikoff and Dr. Hartman, through research, showed that not only did Tobacco 21 in Needham create lower youth smoking rates, it reduced smoking again among Needham adults. So I understand that we know the data and the science, and you all are experts. I ask you to continue the brave choices to protect youth and adults in Needham by implementing the policy and continuing the role of Needham as a leader and looking at science and data I'll stop there. I know that prepared remarks couldn't ever come close to what's already been said, but I thank Dr. Hartman and Dr. Winikoff and all of you for continuing the work to protect youth and adults, limiting access to tobacco. Thank you.
Yeah. Thank you, Carol.
We don't have any more hands up online, Mr. Chair.
Okay.
I did wonder if you wanted to ask, and I don't believe there is, if there's comments on the synthetic drug regulation or the dumpster regulation as well. It doesn't seem like there's anyone here for
As
that.
well, we have people online, you mean?
While we have people.
Because we are gonna, particularly, we're gonna get to dumpsters. So we're running late, but we're gonna get to dumpsters. Right, so if there are none.
I'd like to make a motion that we pass the tobacco free generation policy.
So I would just like to suggest the board, we are still waiting for Cheryl Sabara and sort of the working group that does the model reg to give us some updates on mostly housekeeping and definitions, but also to answer the question on whether the fining structure, if we adopted nicotine-free generation, could be 1,000, 2,000, 21 at the state level, or whether it would have to be 1,000, which is what the state
I can get her. Let me just find. And actually, we have, I can, if you'd like, the law firm that argued before the Supreme Judicial Court, I can get Mark on the phone if you'd like. But I think we should consider getting you an answer right now. Let me try that.
If we can, that would be great, but that's, I see, I think more of a technicality, but we do have a motion to move forward with this. Do we have a second?
Mark Gottlieb did raise his hand.
Yeah, that's who he's calling. So.
Oh, is Mark in there?
Yes, he is online.
Oh, great. Let's have Mark speak.
Hey, Mark.
Yeah, have to unmute. Yep, there we go.
There we are. You know, just as this issue was coming up, my Zoom froze, so I didn't actually hear what the legal or policy question was. I apologize.
So we are waiting on sort of the final model reg from Cheryl Sabara and sort of tobacco working group. But the question that Dr. Epstein had was about the fining structure under Brookline's nicotine-free generation. Can it follow the 100, 200, 500 that is in state law for tobacco 21? Is it capped at 1,000, or is it capped at what the town charter allows the community to fine?
Right. My understanding, and I'm not absolutely solid on this, and I'm sorry, is that there is some leeway in terms of how the individual jurisdiction wishes to proceed on the fine structure, and it would probably be best to confer with our colleagues on the working group, but I you know, and I certainly believe firmly that the state fine level is the appropriate one as a disincentive for violation, and an incentive for, you know, careful adherence to the regulation. However, I do believe that that there is some leeway for jurisdictions, and I unfortunately I can't give you the definitive answer that you would like.
Okay, thanks, Mark. Kate, did you have an answer to that? You said you had been the original, one of the sponsors in Brookline.
She's still online. Yes.
Tim, Carol told me that she has.
Sorry.
Cheryl.
Go ahead.
Oh.
Yeah, if Cheryl's there. Is Cheryl there?
Yeah.
She's on the phone with Carol. If you could still hear Carol.
Yeah, so it is my understanding, and again, I would check with Mark. I think is that whatever you're permitted to do under the Tobacco Control Act, you can do with nicotine-free generation. In other words, what the Supreme Judicial Court said was that it was consistent with Massachusetts state law that has been delegated to municipalities. So whatever you're doing with Tobacco 21, whatever you did with Tobacco 21 before it became state law, fits under the Tobacco Control Act.
Right, which would mean that we could keep our current fund structure.
I can't think
Tim
of a
knows
legal
you're
reason.
on. Just a moment.
Yeah, I can't think of a legal reason why you couldn't.
Okay. All right, so Carol is confirmed. I mean, I don't like wordsmithing on the floor.
I don't either. I do know that we have a question from town council about that, because it was referenced in the select board letter. And he sent a question about it. So I do think we need to be
I'll
able
withdraw
to.
my motion and we'll delay this until the next meeting.
I think we need to be able to at least have a good answer for him.
Okay.
The board can certainly enact whatever it chooses. It has the power to do that. We may have to clean it up if there's confusion
I
about the
just
finance
have to
structure.
leave about 10:15 because I have a doctor's appointment.
One quick
Okay.
point, there are a number of other towns and municipalities across the Commonwealth that are looking to Needham right now. Meanwhile, the tobacco industry is gaining strength. They're looking to each and every town council. They're contacting every town council in the state. So timing is actually quite important here. I would urge that if you would, feel so inclined to vote and then clean up later, if that is something that you could possibly do, I think that would be very beneficial and would probably help the surrounding towns around you to take action and not be subverted by the tobacco industry.
Okay, I appreciate that. Carol, did you have Cheryl on the phone? Or Cheryl that we're calling her?
Yes, Cheryl's on the phone, so she can hear, but I know you mentioned her twice. So Cheryl, you can hear Tim?
Yes, I certainly can.
So Cheryl, there was just, the chair, Dr. Epstein, had a question or wanted clarification about whether, if we adopted nicotine-free generation, we could use MGL Chapter 270, Section 6, which does the 100, 200, 500, 1,200, 2,000, $5,000 fines, or whether we look to MGL Chapter 111, Section 31, which states local health regulations can include a maximum fine of 1,000.
Here's, this is interesting because I was on a Zoom just an hour ago with my colleagues that are legal TA providers. And what we think, and again, town council is the ultimate decider, but from what's going on locally right now, we believe that you would use the 100, 200, 300 fining structure if you were going to be enforcing the nicotine-free generation. However, for the second offense, the permit suspension and revocation are really the teeth behind the enforcement. You could use a 1,000, 2,000, 5,000 structure. However, the enforcement process would be different. In order to enforce it, you would most likely file an application for a criminal complaint in district court. If you use the 100, 200, 300, then you could issue a ticket pursuant to 21D. The reason we're making a distinction between the NFG enforcement strategy and the new state law act to modernize tobacco control is because that law has regulations attached to it from the Department of Public Health that permit an administrative hearing for violations of state law. And then after that administrative hearing, if someone still is not complying with the state law, then if they're aggrieved by the decision of the Board of Health after that administrative hearing, then they would be able to appeal that to Superior Court. With NFG, because it is not a state law yet, the approaches would be to use the first statute that was mentioned and do it with either non-crim or criminal enforcement if the fine is going to be 1,000 or more, and if it's less than 1,000, to use the non-crim enforcement. And I hope that was clear. If not, I'm happy to answer questions.
Yeah, I think that answers the question. Now it's just a matter of wordsmithing it. You know, what I would suggest is that, you know, they're basically two fine structures, right? So there will be one for the general tobacco reg. So if you sell to anybody under 21, we keep the 1,000, 2,000, 5,000 as we always have.
Okay.
However, if you sell to anybody who was born after January 1st, 2004, the fine is lowered. There'll be a lower fine for that because that's all we can enforce from a fine standpoint. But we do not change the you know, the revocation of the temporary revocation of the permit.
Correct. Correct. And the third option, if you wanted to, would be to keep the fines high, but then you couldn't use non-crim. You could still use an application for a criminal complaint.
Yeah, but that's I agree. I don't think that's the real issue here. It's really the suspension that's the issue.
Exactly.
So let's not get into trouble where we don't need to get into trouble.
I couldn't agree with you more.
And that could always be revisited later.
Right.
Sure.
All right. So we do need to clean that up, but I think that answers, you know, the legal question to town council.
It does.
Okay, then I'll put my motion back in place with the addendum that will clean up the language on the fines.
Right, section U.
As described by Steve.
Does the board want to vote on that, or are you comfortable voting in December, or do you want to vote on it today?
It's up to the rest of the board.
Yeah, I haven't heard a second for the motion.
Yeah,
Okay, we have a second for the motion. Okay. Further discussion. I mean, I'll add one point just because I think this is the time for us to, this is the only time we've really a chance to talk to this. I mean, I see the point with tobacco versus nicotine, and it does bother me a bit. And I've been trying to weigh, you know, I mean, the thing that's on the table is nicotine-free generation, and I don't think it's perfect. And you know, I've been debating kind of how to do this. I would love to see, you know, nicotine-free as nicotine-free at least up to 25. We don't know, you know, because we know the youth effects and we know those go beyond 21. The tobacco stuff, I think, is truly, you know, is something that we really do want to phase out at every age, because we know the health effects there. But, you know, yes, nicotine is addictive. We have a lot of things that are, and it's very addictive. It does have withdrawal symptoms, but do we have a lot of evidence of harm in it, you know, over 25? That's what I don't know. So, you know, one of the things that I was wondering is, you know, do we pass this? And do we have, you know, some sort of either a sunset or a mandatory relook in 4 years? Because in 4 years, we'll be at the 25 age, right? In which case this board makes another affirmative vote to continue it as is. You know, because we'll have more data at that point. We'll know how this has been affected. We'll have some evidence, you know, from the next Metro West survey 2 years from now, whether or not this is having any type of effect. I don't know. I mean, but that's sort of, you know,
we should just do
been what I've been contemplating, because I think overall, I'm in favor of doing it, but I do have those reservations, and that would be one way to address it.
Maybe you can continue this part of the discussion another time, but I'd be curious to know what kind of data we would be looking for 4 years from now to revisit this.
I'm gonna.
And understand, I mean, are there any health benefits or any impact overall to the usage of other substances of abuse, for example? Because one of the points that was made earlier was that nicotine is a start, but then there are other substances of abuse that get added on because of recreational or that dopamine surge that you get after nicotine. It becomes interesting, especially for you.
It does.
So
Yeah,
if that's the type of data, I'm so sorry. If that's the type of data that we want to collect, that yes, reduction in nicotine usage has resulted in reduction in other substances of abuse, then I think that's a fair point to revisit it. But if otherwise all the stats remain flat, then I think that's the opposite. point.
Then you're
Yes.
left wondering. Yeah,
Yes.
no, I know. That's just, I'm saying that's the thing that kind of troubles me about this,
Yeah,
because I think, for combustible or even non-combustible tobacco, it's very, very clear
Yeah.
of the cancer risk.
Yeah.
But, Surgeon General's report from just a couple of years ago that looked at, cancer risk from nicotine said there is no conclusive evidence,
Yeah.
right? So it's not there. It's on the mental health issues.
Yeah.
And we know that we have evidence for that in youth. I don't know that we have evidence for that in adults.
Right, but I also wonder whether that's what has resulted in vaping devices. Because then you start having a much bigger surge of nicotine in consumption, and then those effects downstream. So I'm also trying to reason it. I like the idea of revisiting in 4 years, actually. By collecting more data and then understanding what were the impacts, positive or negative, of this motion. But I'm very much in favor of second.
Would you be opposed to passing it and revisiting it, or do you want to stick in a sunset provision?
Well, so how do you make a mandatory revisit in 4 years? I'm not necessarily saying sunset it, because then you have this argument coming up again 4 years from now, right? But I think you have to, I'd want to see us relook at this once we hit that 25 mark and say, all right, does this make sense? And I kind of want that, really built into this somehow. I'm not sure the best way to do that. And if that's again wordsmithing, then, maybe we, take that up next month. I don't know, but I'd rather not.
It may take longer than that to see
the effect.
So therefore, I would just say that there's nothing in this ordinance that prevents a look in next year or 2 years or 2 years. And however frequently you want to revisit, you can always do that.
Right.
And that this doesn't prevent any of that. And that in fact, I will promise to you to work very hard on the data so that and keep you informed as I gather data for what happened in Brookline each and every year. You look at that data, we'll have a dialogue, and I promise to give you that data open and honestly, whichever way it shows over time. So you can look at it 1 year, 2 year, 5 years, 10 years, however long you want, and can always consider redoing the regulation so that you don't need to put a specific date into this regulation to make that happen. You will always have access to the data. You guys are Needham, Massachusetts. You have a special place in the world for tobacco control. You will always have the best data. I promise you.
No, and I know we kind of built that into the, to the town fields when we went with it, so we were testing every year.
Yep.
But we didn't have that in reg, right?
We didn't have it in reg. We did have it in the budget. And then the board moved to every other year for the environmental testing. Yep.
All right, so we do have a precedent for looking at stuff.
Right, but to some level, all the board has to do is tell me as the director, you want this to come up again and again, and we put it on our annual schedule that we have to talk about it, Obviously, there's a MetroWest Health Survey that was administered in fall 23, and be one in fall 25, and hopefully fall 27. So we will get the data. For that reason, we can certainly talk to Brookline and look at the comparison for their YRBS. We could talk to Anthony and some of the communities that Maureen Busby had worked in and see what their data has shown.
Okay. All right. Any other discussion?
No.
Tejal, you're still online? Just want to make sure that
she's not. I did text her. She said she had to step off and she's dealing with some work things. She can't step back on. We do still have a quorum.
We do have a quorum. I think we know where Ed stands at least.
Yes.
Okay. Well. No further discussion. I guess we take a vote.
Okay, good. Let's,
I have a question about another part of the regulation, because Tara and I will be the
Yeah.
ones kind of enforcing this.
Mhm.
There's a section in this regulation about oral nicotine products and how they can only be sold in adult-only retail stores, and at the moment, I don't think we have any adult retail stores. So it would be kind of a pure prohibition of those products. I just want to confirm that that the board is okay with that part of it.
So is that new in the reg though, or did we just change the date? Because when I saw the, the copy, I thought that was, that had not been a change, that the only change that we had made was the age requirements.
Let's double check what's posted online to be sure.
Yeah, the only thing that was highlighted was page 18, section X.
Okay.
So if that's new from an enforcement standpoint, then yeah, I mean, that would be something that would be an issue.
Because it would probably ban all the oral nicotine products in town.
Right.
So, yeah.
Yeah, and I don't think that was the intent.
Section G, right?
Section G, it's currently in the regulation. No person shall possess, hold, keep, sell, or distribute, or cause to be possessed till blah, blah, blah. Any flavored tobacco product or any flavored tobacco product enhancer, except in smoking bars and adult-only retail tobacco stores for on-site consumption.
Flavored.
Now, item G is, section G is not flavored.
Right.
Doesn't say
Oral
flavor.
nicotine products can only be sold in adult-only retail. So has that been added, or did we just not catch that before?
That was new.
That was added.
It was added.
Um,
Okay. It wasn't highlighted, that's why I missed that.
I'm looking at the current version, what we have currently enacted. And section G just has what I just said, not about the oral nicotine.
our current licensed tobacco retailers are selling.
Correct, they're selling the unflavored
Right.
products. We know what, 3 out of?
We have 3 of them.
3 out of
only
6.
sell cigarette products.
Right. Now we have a couple of things we need to clean up.
Yeah.
I think we do need to delay the vote at this point. I mean, yeah, I don't know how the rest of you feel, but we have to get the fine structure cleaned up. We've got to get I mean, I understand the time, but if we're gonna do this, we got to do this right.
Yeah.
I also think it's important to have all the board members here.
I would prefer that.
Yeah.
If we could.
I think it's important.
All right. All right, so I think we're gonna have to continue this hearing then.
You don't have to continue. If the board wants to accept more public comment, it can continue. If it wants to close the hearing, this hearing and the others, it could.
I think we've heard the comment. I mean, we've had this hearing open for, 4 months or so.
So it
It wouldn't
makes-
preclude the, select board from, talking to us directly either.
No, but if you close the hearing, then next month there could be deliberation and a vote.
Correct. And I think that's where we need to go. People are comfortable with that. Yeah, so let's,
Support that.
all right, so let's close the hearing and a vote will be scheduled. It's not vote likely, it's vote scheduled for next month.
Yes.
All right.
Okay. Do you want to close the synthetic drug and dumpster regulation hearing as well?
Oh.
Haven't gotten a lot of public interest.
Well, we haven't even talked about the dumpster one.
We could continue that if you want.
All right, so let me thank everybody first off for coming for the tobacco stuff, because I don't want to hold you here, because we're gonna move on to dumpster regulations. Another thing that's just near and dear. But thank you so much. I mean, we've got a couple of housekeeping things, but the testimony has been very helpful. From all the various groups.
I did not.
Okay. So we're gonna lose a quorum then in about 5 minutes. So what do we need to do in 5 minutes? What can we do in 5 minutes?
Probably adjourn.
Yeah, so I think we're just gonna have to continue the other 2.
Yeah.
Right?
Well, synthetic drugs haven't had any comments.
Hasn't any comments, so I think we can close synthetic drugs, because that one we've had plenty of time. Dumpsters, I think we should leave open though. Because this is the first time that it's coming up, and we'll have more discussion next time.
Okay.
All right. So let's do it that way, if there's no
I-
objection.
One comment on the synthetic drug regulation.
Yes.
In the section 22(6), I noticed that the synthetic kratom has also been deleted. I thought that we are removing the natural product extract and keeping synthetic kratom during our previous discussion, which is where we included the metabolite.
I think you're right.
So.
Okay, we weren't supposed to take out all kratom, we were just supposed to take out
We were-
synthetic.
Yes.
No, leave the synthetic in the reg.
Sorry.
The natural one, which is what the kratom folks thought was, the
Yeah.
pure, let's not muck with that one.
Yeah.
Okay.
Take that out, but synthetics, we were gonna leave in.
Right, we did leave in one synthetic, right? The 7-hydroxymitragynine.
Right, which I thought.
But there's another
So
one.
metabolite.
Oh, that's metallic. I see.
Discrepancy in the
Oh,
bylaw,
yeah,
it's
yes.
The metabolite and not with the.
Okay, right.
the-
You gotta take the metabolite out and,
Either you have to take the metabolite out, or you have to include the synthetically derived kratom. And I
Yeah.
think what we heard in one of the earlier public hearings was that synthetic kratom was indeed associated with some of the adverse events.
Right,
So we
right.
may just want to revisit that, or
I would which line under 22.4 is that?
22.3.
22.3 definitions is one place you could do it under psychoactive substances. Although the metabolite is the psychoactive substance, so you have it in 22.6.
I think I saw it in 22(6). Wherever we have that concluding paragraph.
Which number? Because that's enforcement and penalties.
Then it was 22(3). Okay, sorry.
Yeah, that's 22.3 is the definitions.
Okay.
Wherever there's a highlighted yellow line.
Yeah.
Which is crossed out, I think, my apologies, Nicholas.
Yeah, I mean, we're gonna have to kind of. Yeah, you probably define synthetically derived kratom and put that in as a definition where you have kratom crossed out.
There it is, 22.
Add in synthetic. Yeah, I think synthetically derived because, and then take out the metabolite from the psychoactive substance part. So we have that cleaned up.
Okay, so Artie, I'll go over with you
Yeah,
the
sure.
changes. I'll email you and just confirm them, and then we'll put that into the red line.
Yeah.
Yeah.
Okay.
Yeah, it is 22(3). My apologies. I thought that was
Okay.
what it was.
And we wouldn't change 22.4 then. Or no, we would change.
You would change
Yeah, you have to
22.4,
change.
yeah, you would,
Yeah.
yeah, same thing, you would take
Okay.
out.
You either take out the hydroxy or you incorporate the synthetic.
Yeah, so take out the 7-hydroxy and just put in synthetically derived kratom at that point.
Okay.
Yeah, the tough part's gonna be defining that.
Yes,
That's where Artie's gonna help you,
yes,
right?
yes.
So there you have it.
Okay.
Sorry.
All right. No,
It's important to
this
get it
is-
right.
It's important to get things right,
Yeah.
so we will do so. All right.
Okay.
With that, we're at 10:30. And no, that's okay, because I'm
Somebody's gonna make a motion
to adjourn.
Oh, yes, I make a motion to adjourn.
Second.
Okay, without objection. All right. Our next meeting will be
December 13th.
December 13th. Okay, so only 3 weeks from now. Okay. Yeah. Is that it? What time are we
8:30
doing?
At PSAB, which is.
8:30 PM, AM?
AM.
Okay.
It's not, it's a Friday. It's not the ideal time or location, but
Here.
No,
PSAB 500 Dedham Avenue.
And that'll just be a vote.
It's just gonna be a vote.
there's not gonna be a
Just-
hearing.
you got- Okay.
Yeah.
Okay, so it
So hopefully we'll have all the technical stuff
Gotcha.
wrapped up and then we can have a vote. So that's not that far away.
That's very good, because new